So first of all, what is a health promoting school? A health promoting school is one that works in collaboration with the school and the broader community to provide supportive environments that nurture health and holistic well-being. Successful health promoting schools thrive on collaboration. Focus is extended beyond school bounds to encompass partnerships with parents and the wider community. We have come to talk to you today about the dangers of obesity and how we can make a positive impact as teachers to supply our community with as much rich information as possible. A child is considered to be obese when they have a body mass index or BMI of over 30 or more. An individual's BMI can be calculated by dividing their body weight in kilograms with the square of their height in meters. Here you can see a table showing the 4 levels of weight and the BMI to represent them. Have a look and see which level you're in. According to the Department of Health, 20 to 25% of Australian children are overweight, and a quarter of that is obese. This is a concerning number as there are many dangers to being overweight or obese. Without proper intervention, these health risks can continue into adulthood with the possibility to develop additional problems. There are many causes of obesity, but we are here to focus on the nutrition factors. A typical diet of a person who is obese consists of high calorie and low nutrient food and beverages. Students at Broadbeach State School have easy access to major shopping centres and fast food outlets, putting them at risk of falling into the obese category. Our school services a diverse population in terms of cultural and language background, socio-economic background and learning needs. Students come from places across 63 different countries, with the majority coming from New Zealand, Japan, the UK, China and India. There are 50 students attending this school who speak a language other than English at home, with 22 different languages being used among these students. Students might be more inclined to make healthier decisions at lunchtime if there was more cultural variety of tuck shop options. Over half the menu includes items from the amber and red sections of the food and drink spectrum. The school prides itself on academic, dance and sports programs, and students at our school have a high engagement with physical health activities, but nutritional health outcomes are still lower than we would like. The school is situated in a low to middle class socio-economic area, with a vast amount of students belonging to single parent families. This means that some parents aren't going to have the time or money to cater for the nutritional guidelines. The things we are proposing today will increase overall self-sufficiency of the school's healthy eating programs and affordability, efficiency and convenience for the families. In the last 4 years, the school has seen a dramatic decrease in suspensions, with only 10 recorded incidents in 2016, down from 22 in 2013. We believe this is from the increase in parent and community involvement in the school and the push for more meaningful school programs. Due to these programs being so successful, there is enough extra funding to get these health programs up and running, if they were to be approved. With the high level of engagement in the sports programs, it would be a fantastic opportunity to complement with healthy eating programs to combat the rising obesity rates within Australian schools. We have started to promote information in our tuck shop menu, but it is time to get students and parents involved and passionate about the push for an overall healthier community. We constructed this proposal in line with the Health Promoting Schools Framework. The Health Promoting Schools Framework outlines 3 interrelated target areas: curriculum, teaching and learning, school organisation, ethos and environment, and partnerships and services. Let's look at curriculum, teaching and learning. At Broadbeach State School, we use the Australian Guide to Healthy Eating and the Smart Choices Spectrum to help students make smarter decisions when it comes to healthy eating. We feel that there are a good set of guidelines and information available, but students are still unsure and uncaring when it comes to the rising rates of obesity in adolescents. We are looking to increase engagement in this topic by holding a food festival each year to showcase what students and members of the local community know about health and well-being. The Health Promoting Schools framework outlines that students and members of the local community need to be actively engaged in planning the school curriculum. Students from each year level and members of the local community will be invited to be a part of the school health committee through the school newsletter and Facebook group. Monthly committee meetings will be held to plan for the food festival and ideas that can be integrated into core learning areas. Students on the committee will be expected to conduct a monthly survey on a small selection of students' eating habits from their year level for data collection. Time will be allocated during year level collaboration sessions for classroom teachers to discuss ideas from the health committee meetings. This time will also be used to discuss where healthy eating can be implemented into core learning areas, such as in maths, students could analyse the amount of sugar in different drinks they buy. Cyril Jackson Senior High School in Bassendean, Western Australia have run a food festival for many years and are very pleased with the result. They found positive interaction from the students and local community and an increase in awareness of health issues concerned with nutrition. They found some major barriers to be the weather and finding the funding for catering and entertainment. To combat this, we would like to add Cooking Academy into the weekly timetable where students will be able to go during school and lunchtimes to learn how to cook healthy meals. Ingredients can be used from the community garden and top performing students can showcase their meals at lunchtime as a tuck shop option. We hope that students from the Cooking Academy will be able to help run the festival stalls and showcase healthy meal options they learnt to cook throughout the year. Members from the committee will work with these students to make sure each stall is a health promoting one. Using ingredients from the community vegetable garden will also minimise costs, and local businesses have agreed to provide discounted goods in exchange for promotion at the festival event. We would also like to suggest combining this event with the yearly Performing Arts Festival in order to reduce entertainment costs. The festival gives students a chance to share their culturally diverse backgrounds and knowledge of healthy eating. We are hoping to continue having these interactions over the years, as it is starting to fill gaps in the education of the students' general health knowledge, skills and connections. The school organisation, Ethos and Environment Arm considers the establishment of a welcoming and supportive physical and social environment. It relates to the introduction of policy and decision making and the overall positive or negative atmosphere established by these procedures. Creating a school atmosphere that is supportive in all its policies and initiatives will advance the health status of the school community. The provision of healthy or unhealthy food options to young people influences their eating habits. Broadbeach can influence student eating habits through a healthy canteen menu, crunch and sip program and healthy lunchbox initiatives. The Smart Choices Healthy Food and Drink Supply Strategy for Queensland Schools outlines recommendations for the sale of healthy and nutritious food. This is based on the Australian Dietary Guidelines for Children and Adolescents and the Australian Guide to Healthy Eating. Here are the categories where food is put into 3 colour groups based on nutritional value. Newmarket School has introduced a menu that is 80% green, 20% amber, and 0% red. Popular menu items include fresh fruit smoothies and design your own salad and sandwiches. Broadbeach State School can expect similar outcomes to that of Newmarket following the introduction of similar menu items. Newmarket State School has noted reduced behavioural issue and improved academic outcomes. Additionally, an increase in healthy eating habits of students, interest and involvement of parents in the new menu, and a rise in healthier lunchboxes has been noted. Newmarket has formed partnerships with dietitians and health promoting organisations. Seeking support from dietitians and organisations such as Go for 2 and 5 will provide resources for teachers, students and parents to ensure this transition is a smooth and well supported one. To support our whole school community, menu price reductions should occur to accommodate low socio-economic situations. In addition, diversifying the canteen menu to reflect the multicultural nature of the school community ensures healthy options are available to all students. Menu items such as curries and sushi have received a positive response and are considered green zone foods. Sip and Crunch programs are highly represented in schools across Australia. They involve the consumption of fruit and water during morning and afternoon class periods. The time is designed to refuel nutrition and hydration requirements to aid physical and mental well-being and stimulate concentration and engagement. Sip and Crunch is an opportunity for schools to model healthy eating habits. Instilling the behaviour of eating fruit at least twice daily is a positive habit to carry into adolescence and adulthood. Such habits will reduce the risk of obesity. At current, research shows that 3 in 10 students' fruit consumption is inadequate. Sip and Crunch is an effective way for schools to monitor and promote fruit and vegetable consumption. The Partnership and Services arm of the Health Promoting Schools approach values school, parent and wider community collaboration. Health Promoting Schools involve the whole school community in decision making and extend invitation for involvement to community groups. Such practices enrich access to resources and knowledge. The committee proposes the school's collaboration with Broadbeach Community Garden Group. At current, the group is planning in collaboration with the City of Gold Coast Council to install a community garden to service the Broadbeach community. Partnership with this community group has multiple benefits for our students. The project enables hands-on engagement in planning, planting and harvest of produce. It is recognised that many young people do not know where fresh produce comes from. This is a concern for healthy eating habits of young people both now and as they transition into adulthood. The community garden exhibits many opportunities for exploration of curriculum disciplinary areas such as mathematics, science and HPE. From a health perspective, the community garden will involve students in the process from garden to plate. As discussed previously, the produce will be incorporated into the proposed Cooking Academy program and school canteen. The garden project will empower students with the knowledge to make healthy consumer choices and explore health promoting options such as installing vegetable gardens in their own homes. Bittern Primary School implemented a conjoined garden and kitchen project and found pleasing results. Students developed an understanding of the process from garden to plate, including knowledge of the plant growth cycle and preparation of nutritious foods. The garden project at our school will empower students with the knowledge to make healthy choices and the skills to prepare nutritious meals, including the use of produce from their own gardens. The interest of students at Bittern and engaging in gardening at home spiked, with some students even starting family-based vegetable and fruit gardens. Prospective outcomes at our school will improve the health of our students and their families. Student interest in home gardening will stimulate family interaction and healthy eating, thus consequently lowering the risk of poor health, including obesity. The Community Garden Project will be a wonderful health promoting initiative for the entire Broadbeach community. It will increase access to nutritious foods for individuals from a low socioeconomic background and encourage the community as a whole to make healthier eating choices. Success of the program will demand the strengthening of community collaboration. Bittern Primary School recorded improved social competencies with their students. Interacting with community members and working in groups to complete tasks will also improve the social communication and teamwork skills of our students. Building the sense of community through the garden and associated initiatives, such as the Food Festival, will encourage healthy eating throughout the whole community. This is an excellent reflection of the Ottawa Charter Action Area Strengthening Community Action.